House resumes and debate continues. Yes, Honorable Laville. Yes, Honorable Laville. Oh, okay.
Yeah.
Yes, so I recognize the Minister of Health, Honorable Laville, and Parliamentary Representative for the Mao constituency. Please proceed.
Mr. Speaker, greetings to you. Greetings to my colleagues. A lot has been said today and the days before that. Quite a bit, Mr. Speaker. Many things have been said about the Ministry of Health. Big things about the ministry, Mr. Speaker. Today I stand here, Mr. Speaker, as the Ministry of Health, Wellness and Social Services, and I am obliged to respond. And Mr. Speaker, it's known I am also too, and I have the pleasure and privilege to be the parliamentary representative of the Great Mao constituency. And we all know that it's a very big constituency. So, Mr. Speaker, you see a recurring theme, a big ministry, a big constituency, and also too, the opposition, they have offered a lot of big misrepresentations. So, Mr. Speaker, permit me to refer to my notes a few times as well, because—
Permission granted.
Thank you very much, Mr. Speaker. So once again, good afternoon to you, Mr. Speaker, and all my esteemed colleagues in this chamber today. Greetings to my beloved family, my dear friends, my wonderful constituents, Mr. Speaker, from the Great Mao constituency. And I speak of the people of Mao, Mr. Speaker, Massa, Kenfield, Warner, Campbell, Jimit, Taru, Laiupak, all across the blessed borders of this great constituency. Greetings to them, greetings to all Dominicans, Mr. Speaker, who are viewing and listening on various platforms. And I must at this point take the opportunity also to express my sincere gratitude to the wonderful people of the Mao constituency for electing me, Mr. Speaker, for voting for me overwhelmingly, Mr. Speaker, at the last general elections. Mr. Speaker, many things have been said, offered by the opposition, and there have been responses by my colleagues, Mr. Speaker. I want to, at this point, clearly express my congratulations, Mr. Speaker, to Honorable Irvin McIntyre for delivering what, in my view, is an excellent presentation. Congratulations to you, Dr. McIntyre. And Mr. Speaker, for his first time, he went at the crease, Mr. Speaker, and he took it for 6. Every bowler that came, Mr. Speaker, he took them for 6. He was exceptional. And this is a man I have known for some time, and this is really, in fact, Mr. Speaker, the manifestation of commitment in the person of Dr. Honorable Irvin McIntyre, Mr. Speaker, and I'm glad to be on this side, Mr. Speaker. I want to thank him also, too, because I am inheriting a ministry which he led with distinction, Mr. Speaker, for 3 years. Big boots to fill, Mr. Speaker, in a time when he led us through a pandemic, the worst that we have witnessed, Mr. Speaker, in our lifetime. And may I say, he did it well, Mr. Speaker. Mr. Speaker, this budget embodies the principles of honesty and tremendous hope, and it addresses many of the most pressing challenges that we face. It prioritizes various issues, Mr. Speaker, and it tackles some of the biggest problems that we are confronted with. And whilst doing that, it clearly states the pathways that exist to lead us to prosperity as a people, Mr. Speaker. But they will not see it on the other side, Mr. Speaker. No matter how closely they look, what lens that they use, whatever glasses that may be prescribed, Mr. Speaker, they will not see it, Mr. Speaker. They will not see it. Say, for example, when we listen to the utterances by Senator Paris, for example, my dear fraternal engineering colleague, Mr. Speaker. Sometimes I wonder why he's so consumed with trying to impress. We need to just be ourselves, Mr. Speaker, in this house. Be open, be honest, be responsible, and that is enough, Mr. Speaker. When we in one presentation use 3 different accents, Mr. Speaker, none of which sounds like any Marigot person I have ever met, Mr. Speaker, one must wonder, what is your preoccupation? Are we trying to confuse the people, Mr. Speaker? Are we taking our last names too seriously? Mr. Speaker, to come in here, Mr. Speaker, and act like you understand the budget, and to offer to us here in this chamber and to all of Dominicans that the Ministry of Health, Wellness, and Social Services only used 36%, I stand corrected, of its allocation, Mr. Speaker. This is dangerous, Mr. Speaker. Mr. Speaker, how in a time of COVID, Mr. Speaker, could you come here and offer that to the people? If you do not know, simply ask a question. But don't offer us your rice and sardine like Senator Laurie said that the people are eating as facts, Mr. Speaker. Ask us. Ask the comptroller, the budget comptroller, Mr. Speaker, and then they will tell you it is not 36, it is in fact 86%, Senator Paris. Mr. Speaker, I recall last night, from 7 o'clock, when our Prime Minister rose and offered them on the other side a lecture, guidance, instruction. But I recognize that someone was absent, Mr. Speaker. And I wonder if it's not time for us to take a look at the rules for the House as well, because I do not understand, Mr. Speaker. And maybe someone is taking a page or maybe the whole book from one of his predecessors, Mr. Speaker, to stay away from the House when the Prime Minister is speaking at a very important time. Because to use this precious God-given time, Mr. Speaker, and choose instead to go on the radio, Mr. Speaker, and to be interviewed about the budget by a pastor, Mr. Speaker, this is abhorrent. And he cannot even answer the questions being asked by the pastor. So he ran back inside here to finish listening to the lecture by the Prime Minister, Mr. Speaker. We need to look at the rules, Mr. Speaker. We need to look at them well. Mr. Speaker, when I look at Senator Sean Douglas, Mr. Speaker, I really had hope for him. I did. Maybe some of you all might be wondering why, but I know, based on history, he comes from serious pedigree and lineage, Mr. Speaker, by virtue of the last name. But, Mr. Speaker, to leave your family where there are heroes, many heroes, Mr. Speaker, and to choose instead to go on another side of the country, Mr. Speaker, somewhere in the Northeast to search for heroes, and I'm not saying there are no heroes in the Northeast, and to do the same thing, Mr. Speaker, similar to that 60-minute embarrassment that our nation saw, and to do just the very same thing in this House, and to seek, Mr. Speaker, to embarrass a nation, to attempt and to besmirch your country, Mr. Speaker. That is unacceptable. And to offer it the innuendos, Mr. Speaker, and to impute improper motive knowingly, and the next thing you say is that I know, is it improper motive? Am I imputing improper motive? And to pull it back and say I said it already, that's not parliamentary. You need to do better. Senator, you need to do better. And then we have another one, Mr. Speaker. Another honorable member, Mr. Speaker. And I have 3 children, and my eldest is a girl. So, of course, I think I've made my contribution here. Yeah, I've made my contribution. My eldest is a girl, Mr. Speaker. So, of course, that's when I get the opportunity to know about new movies. So I heard about a new Barbie movie that is out. It's in the theater, Barbie doll, Barbie. All right, Mr. Speaker? And sometimes I wonder, Mr. Speaker, if the budget preparation for a certain person in this house, it happened while watching the Barbie movie, Mr. Speaker. Did they just simply, where's the budget, Mr. Speaker? Let me look for it, the estimates. It seemed to me, Mr. Speaker, for many of them on this side, that budget preparation was this. They picked up the draft, they looked at the cover, some watched the Barbie movie instead of flipping through the pages, while others listened to talk on the block, they close it and they throw it away, Mr. Speaker. That's the sense that I get here. That's the sense. Teacher Bonnie, can you take it for me, please? Thank you. Mr. Speaker, and I say this because to come here, and I tried to stand at the point where Senator Reid was making these assertions, Mr. Speaker, that a license was a tax. But in my confusion at that point, I rose and I said that I'm standing on a point of order, when I really should have in fact said I'm standing on a point of correction, Mr. Speaker. And you asked me to take my seat, and I gladly oblige, Mr. Speaker, because I respect you, and I respect you.
Yes, you respectfully took your seat.
Absolutely.
Yes.
And I'm grateful for the opportunity now to correct her, Mr. Speaker. A license, it's not a tax, my friend. You must read. Senator Reid. And when you read, you must try to read with understanding. Okay? Thank you, Mr. Speaker. Mr. Speaker, when I listened to the utterances of Senator Vidal, it was a confused state of excitement. I could not understand anything that was being said, Mr. Speaker. I'm sorry to seem so harsh, but I like Afro beats, and I was just reminded of a song by Rima, Calm Down, Mr. Speaker. She needs to listen to this song. Calm down a bit, take it down a notch. Take it down a notch. And understand where you are. Understand the seriousness of this house and the business that we're asked to do on behalf of the people of Dominica. It is not a joke. It is not a game. It is not for your friends to like and for attention and memes on social media. That's not what this is about. Mr. Speaker, it's interesting also, and I won't take, I would say, a hard stab at the representative from Margot, but he's on the side. So he has to be ready, he has to burst too. But it's interesting that they call this the worst World Creole Music Festival lineup ever in the history of Dominica. But the night of the launch of the lineup, the Minister for Tourism had already started receiving requests for tickets in advance, Mr. Speaker. So how is the worst lineup there, Mr. Speaker? We must not say things and you really mean another. Mr. Speaker, we must stand for something. Mr. Mr. Speaker, let's take a brief look, and I won't be very long on this, Mr. Speaker, because I know the nation wants to hear about healthcare. There's a lot of excitement, but I need to address some of the other things that have been presented. Mr. Speaker, this budget that has been presented, and I must say again, extremely well, it focuses on many of the issues that target economic growth, Mr. Speaker. And it speaks to large investments in areas of agriculture, in tourism, social welfare, healthcare, education, and so on, Mr. Speaker. It's a budget for everybody. It's a budget for the farmers, the fisher folks, tour operators, vendors, young people, or constituents, everybody, Mr. Speaker. Mr. Speaker, it's a very well put together, well crafted and constructed budget, Mr. Speaker. It's one that speaks to survival. And Mr. Speaker, what we have done by way of some of the decisions that we have taken, and I speak to the measures that we have put forward. Many countries speak of their domestic policy, Mr. Speaker, and they speak to development and strengthening on the domestic front. And this is all we are doing, Mr. Speaker. We are developing our domestic policy and our domestic agenda, Mr. Speaker, by incorporating some areas of strength and strengthening, Mr. Speaker. And we have coined it this year, from last year, the national reset. And I'm happy that we did that and to bring more focus and attention to what we are doing, Mr. Speaker. And investing on your domestic front is positive. It's positive. It enhances competitiveness, Mr. Speaker. It helps create a more business-friendly environment, Mr. Speaker. It gives the opportunity, Mr. Speaker, when you strengthen on your domestic end to ensure that there's greater satisfaction with your workforce, Mr. Speaker. It promotes entrepreneurship and it drives economic growth and provides a country that promotes much more prosperity. Mr. Speaker, and this is why that I've said I've been baffled by the utterances on the other side, Mr. Speaker. Because I don't think any of them took time to listen, to pay attention, and to read through what was offered. But instead, they came to prove themselves and to offer their understanding of opposition, which may just be rejection, Mr. Speaker, and instead to launch a lethal attack on many of our public officers. And they may wonder, what am I talking about? But Mr. Speaker, when you come and you put out false information, Mr. Speaker, and you tell the country that infant mortality is on a rise, Mr. Speaker, what you are in fact doing, Mr. Speaker, like PM said last night, you're not attacking him, you're not attacking me, you're launching a lethal attack on the OBGYNs and the midwives and the people in sterilization doing their very best to prevent sepsis and to fight infection. And everyone in facilities management and the engineering department to ensure that the autoclave is working and to ensure that we have another one in order, because we do have another one in order from Italy. These are the things that are going on in the Ministry of Health. And when you check your numbers, you need to check your numbers well to present information that is correct. Because in truth and in fact, over the past 10 years, infant mortality has been declining rapidly in Dominica, and it has in fact decreased by 60.5%. These are the facts. These are the facts, so take notes. Listen, Senator Reid, listen, take some notes. Listen. Mr. Speaker, and while our goal is in fact to get to 0 deaths, Mr. Speaker, we are well on our way. We are well on our way. And I'm grateful to the staff at the hospital for doing their best to reduce these numbers drastically and keep our children alive and give them a fighting chance at survival and prosperity. Mr. Speaker, these are the very same people that we called frontline workers 2 years ago, and now we're accusing them of being part of a health system that is failing. We must remain consistent. Or probably it's that. Mr. Speaker, the pitch might be against us, Mr. Speaker. Mr. Speaker, it might be a bowler's wicket. It might be. The odds might be against us, Mr. Speaker. But when we get that right ball, Mr. Speaker, we pounce on them for 4 and 6s, Mr. Speaker. That is how we operate, Mr. Speaker, as this great Dominica Labour Party government. And steadily and consistently, even when we don't get those good, sweet opportunities, we take our singles every day, steadily. And that is how we have run this country. Mr. Speaker, the IMF has reported growth for us, 6.9% in 2021, and also 5.7% in 2022. Honestly, Mr. Speaker, have we truly pondered on these numbers? Do we know what that even means? Mr. Speaker, we have been fighting challenges and difficult circumstances, exogenous shocks, Mr. Speaker, for so long. We heard PM last night where he said he feels like Job sometimes, Mr. Speaker, tested time and time again, from one to the other. And all the surplus that was reported from previous years, and I'm speaking before Erica, this could have been used to invest in the country and invest in the economy, Mr. Speaker, to achieve more gains and more growth. But instead, Mr. Speaker, we had to rebuild the country. Oh, dear, an opposition party or group or conglomerate, I do not know what it is. I don't know the right expression, Mr. Speaker. I do not know. How can they come here and trivialize all the gains we have made and the facts, the circumstances, the true, honest circumstances that our people have faced? This is completely unacceptable, Mr. Speaker. But you know, the world knows the truth. People that matter know the truth. The grant organizations know the truth. Friendly governments know the truth, Mr. Speaker. Just recently, Mr. Speaker, we had Governor Timothy Antoine from ECCB and the Deputy Governor, Dr. Valda Henry. They were here, Mr. Speaker, for country outreach. And it's interesting what they're saying. It's a different story from what they on the other side are offering, Mr. Speaker, to us. Because in her remarks, the Deputy Governor said that Dominica has experienced more exogenous shocks than other nations in the region, including Hurricane Maria and Erica. And she further stated, Mr. Speaker, the government, listen well, Senator Reid, the government has been prudent in its use of resources, end quote. And Mr. Speaker, I'll now quote the governor, Mr. Speaker. The thing about it is, a lot of pledges never came. He refers to all the promises that were made that how we will be helped after we were devastated by Hurricane Maria. The truth is, all the pledges never came. The government and people worked together. The government had some savings, and I refer to the near $600 million that the Prime Minister spoke about last night that were put in savings, Mr. Speaker. That's what he is referencing. The government had some savings. It was able to deploy and assist in that period. Without CBI, Mr. Speaker, Dominica would have never been able to achieve that type of recovery because the pledges never materialized, or they just took very long. Mr. Speaker, that's the reality. They can't paint the truth, a different truth. The truth is already painted, Mr. Speaker. The writing is on the wall. This is our circumstance, Mr. Speaker. And this is the high regard that people place this government and the leadership of this great nation, Mr. Speaker. Mr. Speaker, and to come here so casually, Mr. Speaker, in your presentation this morning and say, fire the PM and the PM should fire himself. Mr. Speaker, we have to be careful what we say, Mr. Speaker. And we must examine closely what we ask for, Mr. Speaker. Because, Mr. Speaker, so casually we come here and we're speaking so disrespectfully, Mr. Speaker, with such disdain and disregard for a Prime Minister who has led us through the greatest adversities that we have endured in this country, Mr. Speaker. That is what we're asking. Fire yourself. Mr. Speaker, this is a budget that demands of all of us to think bigger, to dream bigger, to be better, and be much more accountable, Mr. Speaker. And that's across all Dominican sectors, Mr. Speaker. This is what this budget calls for. And we are already realizing gains, Mr. Speaker. Investors have their eyes on us, Mr. Speaker. So when I speak to the American Canadian School of Medicine, for example, Mr. Speaker, and I'm so pleased to report the gains that they have made in such short time, Mr. Speaker. It is amazing. And I know they're on the other side. All they had to offer, instead of congratulating us for congratulating the school and being happy for the good people of Portsmouth, Mr. Speaker, they seek instead to be focusing on what we lost from Ross University's departure. Is that your preoccupation right now? Or preoccupation, the preoccupation of Fenella Wenham is the people of Portsmouth? Mr. Speaker, to come here and inflate what contribution of GDP was of Ross University, Mr. Speaker. I mean, stop living in the past with your old newspapers that making powder in your hand, Mr. Speaker. Mr. Speaker, what else is in that bag, Mr. Speaker? Is that how you prepare? Is that how you prepare for the budget? By reading old newspapers on recycled paper to come and offer new solutions to the people of Dominica? Instead of forward thinking? But God bless Dominicans for choosing the Dominican Labour Party. Mr. Speaker, there's so many benefits that they are not interested in with the investments from the new medical school, Mr. Speaker. And I've been speaking with them. I am so excited for the people of Portsmouth and by extension, Dominica. In very little time, Mr. Speaker, these people together with our help and the facilitation by our government have been able to receive accreditation. by ACCM, Mr. Speaker, and IAAR very quickly, Mr. Speaker. And we have provided all the facilitation to them, Mr. Speaker, so they better not go on the radio in a little while and say, well, they that do it and we had nothing to do with it. Before you do that at 6 p.m. or 7 p.m., whatever tonight, ask the right questions. Before you go and give wrong information. Before you go and tell pastor things that don't really exist. Don't lie to pastor. Confess to pastor. Repent to pastor. That's what you do. Mr. Speaker, our students in Dominica will have an opportunity to attend this university, this medical school. And those who receive scholarships, Mr. Speaker, will have full tuition waivers, Mr. Speaker. And we're looking at ways of incorporating them into our hospital system as well, Mr. Speaker. And to look at opportunities for training for our doctors, Mr. Speaker, for subspecialty areas. These are the opportunities that are there and that's in addition to the medical education and the attention, Mr. Speaker, that will be on Dominica, and the socio-economic development that will result, Mr. Speaker, from this school opening their doors. And we have been reporting that classes will begin in September. I have news, Mr. Speaker, because I spoke to them before I came here, Mr. Speaker. It looks very likely by the end of this month, August, that classes may commence, Mr. Speaker. And not only that, I will go further to say they have already been accepting registration for the semester that begins in January of 2024. So, Mr. Speaker, that's the truth. That's the reality, Mr. Speaker. Mr. Speaker, we have been receiving so many accolades in all of our sectors. In tourism, for example, when I think of the gains that we have made, Mr. Speaker, think of a Dominica that was decimated, Mr. Speaker, in 2017. I recall leaving my home and walking. I was trying to get to Kings Hill to see if one of my aunts, and she and her husband were alive, Mr. Speaker. You hear that? Alive. And I walked across and I got to Pottersville, and you know how they looked, Mr. Speaker, because Rosa River seemed, Mr. Speaker, you know very well. Yes. It seemed like it changed its course and went through Pottersville and dumped all the debris from miles up into Pottersville. And I'm traversing there, Mr. Speaker, and I saw a plane flying literally over my head, Mr. Speaker, and I'm seeing flashes, what I believe to be cameras taking pictures, Mr. Speaker. International media, Mr. Speaker, looking at a country that, in their view, would have never recovered. That is the truth. That is the reality that we're confronted with in this time. And Mr. Speaker, in 3-4 years, Mr. Speaker, to have Time magazine reporting, Mr. Speaker, that we are not one of the best destinations in the world, you know, Mr. Speaker. Mr. Speaker, we are the best destination in the world, you know, Mr. Speaker. Mr. Speaker, we must come together as a country, come together as a nation, Mr. Speaker. We must work together hand in hand, Mr. Speaker, for the development of our country. We must take pride in the achievements that we have made and all the gains that we have made in this country, Mr. Speaker. Despite our different ideologies, Mr. Speaker, there are some common things and themes, Mr. Speaker, that we ought to agree upon, Mr. Speaker. Mr. Speaker, we must choose to be patriots in this house, Mr. Speaker, and not embarrass and besmirch our country and our great nation, Mr. Speaker. Mr. Speaker, I can keep on talking about all the gains we have made in so many sectors, Mr. Speaker. So many sectors. But I know the country is also waiting for an intimate conversation about healthcare. And I am happy to have this conversation. Mr. Speaker, before I go any further, I must recognize my dear friend and colleague, Dr. Cassandra Williams, the Honorable, for the exceptional presentation that she made to this House on the good work that is ongoing in the social services aspect of our ministry, Mr. Speaker. Presentation par excellence, Mr. Speaker. And I merely wish to say as minister that I support her completely and wholeheartedly. It's not someone I knew for a very long time. My first encounter with her, Mr. Speaker, well, only prior to the end of last year, was when she treated my young son at the hospital. Did not know who she was, but I did not see just a doctor in her, Mr. Speaker. That's the embodiment of compassion. She's the right person for the job, Mr. Speaker, and I pledge my absolute and wholehearted support to her and her leadership. Mr. Speaker, Senator Kent Edwards, Mr. Speaker, another champion in our ministry, and while never let his calm disposition fool you, Mr. Speaker. While he was presenting yesterday, I heard the whispers from one of my colleagues, Mr. Speaker, who had never heard him in action before. And I said to him, don't test Kent. Even with his simple disposition, back in the day, Mr. Speaker, and you went to school around his time, Kent was valedictorian of grammar school. Kent was so we're not easy on this side, Mr. Speaker. Don't test us. So the intellectual bankruptcy that they speak of, I need not say more. Mr. Speaker, I could come in this House and make some various points, Mr. Speaker, salient points, about the major developments that have been ongoing in the Ministry of Health, particularly infrastructural development over the years, because if we are truly honest, Mr. Speaker, we will see that in a very short space of time, we have rebuilt 2 major hospitals. And Mr. Speaker, while
24 more minutes.
Thank you. Mr. Speaker, I have big constituency, big ministry, Mr. Speaker. I need big time, Mr. Speaker. And when we get closer to it, Mr. Speaker, I do hope you can grant me big time. Thank you. Mr. Speaker, if we're honest with ourselves, we look at the investments, millions of dollars of investments, Mr. Speaker, in building 2 new hospitals. And I saw on social media, led by many of their supporters, Mr. Speaker, that they tried to ridicule my colleague minister for using the word state of the art. But Mr. Speaker, I make no apologies, Mr. Speaker. We do in fact have state-of-the-art infrastructure, Mr. Speaker. And state-of-the-art equipment, Mr. Speaker. Mr. Speaker, 49 health and wellness centers, Mr. Speaker. Name me another Caribbean island with that investment, Mr. Speaker. Mr. Speaker, we have 1 health and wellness facility for every 1,428 Dominicans, Mr. Speaker. We are outperforming, Mr. Speaker, by way of our facilities, Mr. Speaker, the recommended numbers, the recommended ratio, Mr. Speaker. That's all we are doing. It is recommended, Mr. Speaker, that we have at least 2.5 medical personnel to every 1,000 people, Mr. Speaker, in our nation. We have outperformed that too. We have a little more than 5. to every 1,000 people, Mr. Speaker. That's the reality. That's a government committed, absolutely committed to the health and the wellness of a nation, Mr. Speaker. Mr. Speaker, we have reason to blow our horn. We have reason to herald the great things that have been done in this health sector, Mr. Speaker. But what does that truly mean for a young man who may have been diagnosed recently with diabetes, Mr. Speaker, who is preoccupied instead with the quality of life that he may face in the coming years, Mr. Speaker? How does all of these investments trickle down to each of us, Mr. Speaker? These are the questions that we have, Mr. Speaker. And I want to take this opportunity to enlighten the nation, Mr. Speaker, on that and on what we have been doing, Mr. Speaker. We must admit that right before our very eyes, we have seen drastic changes, Mr. Speaker. In the last 3 years, we have been preoccupied with the COVID fight. But even while this has been a reality, Mr. Speaker, there has been a greater evil that we have been confronted with even in that time period, and I speak to non-communicable diseases, Mr. Speaker. Mr. Speaker, 10 years ago, WHO reported that 3 in every 4 people were dying from NCDs, Mr. Speaker. And if we look around now, it's the same thing, Mr. Speaker. 76% of our people are dying from non-communicable diseases. Mr. Speaker, things are changing, Mr. Speaker. And while COVID is still present, Mr. Speaker, we have to refocus. We have to re-strategize, Mr. Speaker. We have to ensure that we use our fantastic infrastructure and equipment and put it to the best use, Mr. Speaker, to fight the new enemy, Mr. Speaker. And I am humbled, Mr. Speaker. I am honored, Mr. Speaker, that the Honorable Prime Minister, Dr. Roosevelt Skerrit, has chosen me, Mr. Speaker, to lead this fight and lead this battle. Mr. Speaker, I am no clinician, Mr. Speaker. I did biology up to A level, Mr. Speaker, but I've been a consummate science student all my life. But even that, Mr. Speaker, these are not the skills that are required, Mr. Speaker, to lead this sector in this time. These are not the skills. Mr. Speaker, I bring to the table, Mr. Speaker, life experience. My attention to detail, Mr. Speaker, to analyze very well and to think critically, Mr. Speaker, and to look at systems and flows and operations, Mr. Speaker, to look at ways, Mr. Speaker, that we could improve the entire enterprise architecture in the Ministry of Health, Mr. Speaker. This is what I bring to the table. And Mr. Speaker, when we are done, Mr. Speaker, we will in fact realize the full potential of this great and promising Ministry of Health, Wellness, and Social Services. Mr. Speaker, I stand here before you today, Mr. Speaker, to highlight some of the significant gains that we have made in all aspects of our ministry. And may I start with primary health care, Mr. Speaker. And our goal is to enhance the quality of services and to improve, Mr. Speaker, accountability and to foster collaboration among all healthcare professionals in Dominica, Mr. Speaker. Mr. Speaker, we have in fact established a task force. We call it our Primary Healthcare Task Force. And Mr. Speaker, this dedicated team is preoccupied right now with addressing some of the complaints that have been made and operational processes, Mr. Speaker, and to ensure that our ministry operates even more efficiently, Mr. Speaker. They are tasked with the responsibility of creating even more standard operating procedures, Mr. Speaker, to ensure that we have good quality, Mr. Speaker, operational procedures in our ministry. Mr. Speaker, while we are fighting this war on NCDs, we realize that we obviously need to create greater focus, Mr. Speaker, on this fight. So we have, in fact, appointed an NCD coordinator in the person of Dr. Sentil here, a Grand Bay man, Mr. Speaker. I know Vince likes that. A Grand Bay man, Mr. Speaker. And Mr. Speaker, he has been working hand in hand very closely with primary healthcare to fight this NCD plague that we are now facing, Mr. Speaker. And we are doing well. And I know on the other side, Mr. Speaker, they listen to the wrong thing sometimes on the radio, most times. But we have our coordinator and primary health, or director of primary health care. They are on the radio too, Mr. Speaker. And we accept that we need to do more, Mr. Speaker. If we listen closely to the remarks from Honorable Edwards, we recognize that that fight is one that we can't leave to secondary care, Mr. Speaker. We have to take greater ownership and accountability for our own lifestyles and our healthcare, Mr. Speaker. But notwithstanding, Mr. Speaker, our job too is to advocate, and we will do that with the establishment of our coordinator, Mr. Speaker. We will in fact do that, and we have been doing a lot. Even recently, may I report, Mr. Speaker, and we need to take some blame too, I will say, Mr. Speaker, because we have been doing great things, and it almost seems like the nation doesn't know in some areas. And I'll speak to the HATS program, this wonderful program that has been established, Mr. Speaker. And in this initiative, Mr. Speaker, what we have done is, in fact, through the help of PAO, we have had this collaborative effort, Mr. Speaker, to aim at preventing and controlling cardiovascular disease, Mr. Speaker. And by 2025, our HATS model will even be further integrated, Mr. Speaker, into our primary healthcare system, and to expand to address issues like hypertension, Mr. Speaker, and diabetes. And that's the type of standardization of care that I've offered, and this is one of the first examples. And Mr. Speaker, one of the benefits of doing that, Mr. Speaker, is that we don't treat patients based on what we think, Mr. Speaker. We won't be able to monitor our patient outcomes very well, Mr. Speaker, if every clinician is allowed, Mr. Speaker, at their own whim and fancy to treat a patient, Mr. Speaker, and make diagnoses based on their desires, Mr. Speaker. We want greater standardization. Mr. Speaker, in primary health care, we have made sure that we have made available at least 2 district medical officers to every health district. And not only that, Mr. Speaker, we have ensured that we allow people to have access to a nutritionist, Mr. Speaker, and also an endocrinologist, Mr. Speaker. This is what we have been doing. These are the positives, Mr. Speaker. So I must apologize for not tooting our own horn, Mr. Speaker. We have been working. The doctors, the nurses, the lab technicians, they have been working. Mr. Speaker, we have also recognized the need to standardize the equipment that we have at our various healthcare facilities. And I'm proposing, Mr. Speaker, that if and when we do this, Mr. Speaker, and we have already commenced, that maintenance will be a lot easier. So when someone complains that this hospital doesn't have this or the health center doesn't have this, one of the challenges that we have is that we have different specifications of equipment. So while they all work, generally give the same results, but it can pose difficulty to maintain equipment with different specs. When our engineering staff, they might be trained to service one particular model. Yes, you have that, but you may have others as well. It can be difficult. And it's also difficult to keep stock of various maintenance parts for, say, a same nebulizer. It's better for us to have one type, Mr. Speaker. So these are some of the things that we are doing to have greater standardization in our ministry, Mr. Speaker. We have to accept that good work is going on. Mr. Speaker, I move to cancer care, Mr. Speaker. It's another area, another dreaded disease, Mr. Speaker, that is accounting for so many deaths in our island, Mr. Speaker. On Sunday, I had the pleasure and privilege to attend a function initiated by the Cancer Society, Mr. Speaker. It's a luminaries function where many survivors and supporters got together, Mr. Speaker, and I was moved. I was moved to the point, Mr. Speaker, that I registered in that moment to be a member, Mr. Speaker, of the Dominica Cancer Society. And Mr. Speaker, I've already been added to the WhatsApp group and receiving my messages. So that is how Dr. Santilia, the NCD coordinator, didn't tell me, but being part of this group, Mr. Speaker, I know he will be on Kyrie tomorrow at 7 p.m., Mr. Speaker, and he will be speaking about cancer survival, Mr. Speaker. So this is the good work that we've been doing, and I just want to salute the Cancer Society and the good work that they've been doing to support many of these people battling this dreaded disease. And I will tell the nation also too that many people know that our mammogram has been done, and we have been addressing that. Mr. Speaker, I'm pleased to report that the replacement part is here in Dominica, and we are working with the supplier to come down and have this part replaced, Mr. Speaker. So soon we'll be back in operation. I'm also pleased to discuss the fact that we have been working on a cancer registry, Mr. Speaker, and we're working very closely with PAHO on the development of that. We also have recently added another, I say the word new, but it's interesting because I have known her for a long time, Dr. Calendar, oncologist, who is now back. So we have two oncologists, Mr. Speaker. And I must recognize also, when I saw at this function yesterday, how endearing Nurse Richards is, and that's our goodness at oncology, Mr. Speaker. And the way that the survivors, Mr. Speaker, they take on to her, Mr. Speaker, and they receive her presence. I cannot stand or sit and see a launch, an attack on these good people, Mr. Speaker. I cannot. So, Mr. Speaker, in my innocence, Mr. Speaker, I may make a mistake off and on and say, I stand on a point of order when it should have been a correction, but Mr. Speaker, I am happy to stand in the defense right now, the defense of the hard-working people at the hospital and those in primary health care, Mr. Speaker. And never should the opposition use those words to attack these good, hard-working people again, Mr. Speaker. Never. Mr. Speaker, we are also improving the procurement of our pharmaceuticals and our various medical supplies. I had the pleasure, I believe last month, actually it was the month before, to meet with the director, Mr. Speaker, of OECS pool procurement, Mr. Speaker, and we had a meeting where we were able to discuss some of the ways we can improve our procurement, Mr. Speaker, at central medical stores. And it was very positive and encouraging to note, Mr. Speaker, that based on discussions with her, we have a greater opportunity now to receive drugs, Mr. Speaker, at reduced cost. By doing more procurement with them, Mr. Speaker, we have the opportunity to save up to 20%, Mr. Speaker, on cost of procurement, converting from anywhere from 1 to 2 million that we can then use to reinvest into getting even more medical supplies and pharmaceuticals. Mr. Speaker, by working with them, what we'll also do is to ensure, and that's based on the strict procurement and protocols that they use to avoid the occurrences and the occasions of biomimicry and drug counterfeiting, Mr. Speaker. So these are the gains that we are making, Mr. Speaker, in this great Ministry of Health, Wellness and Social Services. It's not sexy, Mr. Speaker. Healthcare is not sexy like tourism and public works, Mr. Speaker. But we are working. We're working hard on behalf of the people of Dominica, Mr. Speaker. Just recently, we made a recent order with them, Mr. Speaker, for medical supplies of $250,000, and we're expecting that to be delivered very soon. And we're looking forward to this continued cooperation. We've also decided, Mr. Speaker, that now is the time to improve and to upgrade and update our drug formulary, Mr. Speaker. And what this does, Mr. Speaker, is that it gives us, Mr. Speaker, a greater opportunity to realize better therapeutic outcomes for our patients, Mr. Speaker. Because we are seeing in some cases that while a patient may be reporting that the hospital does not have this particular drug, Mr. Speaker, what we see in fact sometimes is that we don't order that particular drug, Mr. Speaker. We have something else. So what we'll be doing, and I'm happy that OECS, PPS, they're coming down. They're probably here today, actually. They were expected here today, I'll confirm. They're going to work with us to standardize this, Mr. Speaker, the medication that we order, Mr. Speaker. And we'll be working with various clinicians, and not only them, the pharmacists, and to ensure that we don't have drug-to-drug interactions, Mr. Speaker. We want to ensure that all safety considerations are made, Mr. Speaker, while selecting various drugs to treat and cure various diseases, Mr. Speaker. They will help in that selection process. So if one clinician, Mr. Speaker, were to study, for example, in Cuba and exposed to a particular type of drug, Mr. Speaker, in terms of treating with a particular illness, and the other may do the same in Trinidad and Tobago, Mr. Speaker, what we're going to have now with our new standards, with our new procedures, is that streamlining, Mr. Speaker. And work with CMS to ensure that what drug that we select will be on that list that is ordered. So someone doesn't have to go over there and say it's not there, and then you come back and, well, then what's there? Okay, I'll prescribe this, Mr. Speaker. These are the upgrades that we are making and introducing, Mr. Speaker, an electronic logistic management information system. And we are far, Mr. Speaker, in terms of the work we are doing with that. We have engaged a local company, Open Solutions, and working also with Americas, and we are finished with the first stage of this, Mr. Speaker, to manage all of what I just spoke about with regards to procurement, Mr. Speaker. And this will be intricately linked, Mr. Speaker. It will intricately link all the health centers and the pharmacies, Mr. Speaker, and also to our secondary care facilities, Mr. Speaker. So no longer will you hear something is out of stock or overstock too, because it sometimes happens that because we lack the opportunity with the absence of that electronic system, Mr. Speaker, the ability and the aptitude to properly aggregate all the information and to analyze in very quick time, there's sometimes we are overstocked. And these are the things we're addressing, Mr. Speakers, and that will be rolled out in January of 2024, Mr. Speaker. So I'm looking forward with tremendous excitement and optimism for these upgrades, Mr. Speaker. Mr. Speaker, by way of infrastructure in health and what is planned, it's been some time. We have seen, Mr. Speaker, that we have been investing heavily in health and wellness centers. Also, too, we've spoken about the new Roseau Health Center, Mr. Speaker, the new St. Joseph Health Center, Mr. Speaker, and also to this morning.
Two more minutes.
Mr. Speaker, I move that the minister be granted an additional 30 minutes.
Seconded, Mr. Speaker.
It has been moved and seconded that the Honorable Minister be given an additional 30 minutes. Those in favor? Those against? The ayes have it. Honorable Minister, you are given an additional 30 minutes.
Thank you, Mr. Speaker. Much appreciated. Mr. Speaker, also to St. Joseph Health Center, Mr. Speaker. Very optimistic and excited about that. And you would have heard the announcement by my colleague, my member for Grand Fond Rivière, Mr. Speaker. She has had some challenges over there as well too, Mr. Speaker, and I know she's very excited about receiving her health center, Mr. Speaker. So we'll work very closely with her and bring improved care to the good and blessed people of Grand Fond, Mr. Speaker. Mr. Speaker, I now move to secondary healthcare, Mr. Speaker. Dominica China Friendship Hospital at this time. Of course, it's clear to see, Mr. Speaker, the major investments that have been made, Mr. Speaker. The new inpatient facility at the Dominica China Friendship Hospital, Mr. Speaker, has an increased bed capacity of 50. So we're now at 310, Mr. Speaker. And that is, in fact, a major improvement. And what this also offers, Mr. Speaker, is more privacy for people at the hospital. Because we have a maximum now of 4 people, Mr. Speaker, in the rooms. We also have private rooms and, semi-private areas, Mr. Speaker. And it allows also for more focused care by our nurses and doctors, Mr. Speaker. The outpatient facility at the hospital, as you can see, it features a 2-story building, Mr. Speaker. And it's needed because when you hear the numbers that we receive through our outpatient facility, Mr. Speaker, you will understand why we need such a facility. Mr. Speaker, in terms of what has been going on at the hospital, there have been tremendous advancements, not only infrastructure, beyond infrastructure, in terms of the operations, Mr. Speaker. So we have hired a safety and security manager at the hospital. And there have been many improvements. You could see right now, for any one of you who visits, you would need a gate card to access, Mr. Speaker, some areas, Mr. Speaker, including the wards. You'd see there are many more cameras, Mr. Speaker, CCTV, Mr. Speaker, at the hospital to ensure safety and security. This is what we've been working on. And this is why, in very quick time, if we recall, Mr. Speaker, I believe some time last year when this unfortunate incident happened at the hospital, very quickly we were able to identify the assailant, Mr. Speaker. And never will that happen again. Mr. Speaker, if we speak to the inpatient admissions at the Dominica China Friendship Hospital, we have had over 5,000, Mr. Speaker. 5,465 people, Mr. Speaker, have been at our hospital last year, Mr. Speaker. You hear this? 310 beds, Mr. Speaker. 5,000, Mr. Speaker. 465 patients. These people have been working hard, Mr. Speaker. When we speak of our outpatients, Mr. Speaker, 14,833. So our consultants and our specialists have seen over 14,000 people just last year, Mr. Speaker. And we casually come there and attack them. Let's discuss the eye care center, Mr. Speaker, the Brenda Strafford Eye Care Center. They have seen over 4,000 patients last year, Mr. Speaker. You see the floors, Mr. Speaker? Thousands and to casually come there, Mr. Speaker, and bash and criticize. I can't stand and listen to this and say nothing. Mr. Speaker, but this tells a story of where there's tremendous concern, and Senator Kent Edwards started telling that story yesterday, Mr. Speaker. But when you hear these thousands, population of 70,000, 14,000 through outpatient clinic, Mr. Speaker, you have a population, Mr. Speaker, that to a large extent should take more ownership of their healthcare, Mr. Speaker, and change our lifestyles and our personal choices, because our people are sick, Mr. Speaker. And we will do our part as a ministry, but we must also play our part as a people. Mr. Speaker, we know we have had some challenges in certain areas as it relates to appointments. I too, when I see people in my office on a constituency day, I remember meeting one of my good friends from an area called Mount Zion in Mau. And he came to me, Mr. Speaker, with an appointment, an eye appointment for 2024. And I was startled, I could not believe that. Immediately, Mr. Speaker, in the usual fashion of the hardworking people at the hospital, and I will report too, we have also hired an analyst quite recently. And she was able to analyze the flows, Mr. Speaker, and to investigate that major concern of having these protracted appointments, Mr. Speaker, out there into next year. And very quickly it was fixed. We recognize the deficiencies, Mr. Speaker, in the way we made appointments in that area, Mr. Speaker. We recognize that. And very quickly, Mr. Speaker, what would have been a 383-day wait period, Mr. Speaker, was quickly addressed in a matter of 4 weeks, Mr. Speaker. After developing a quality improvement plan and implementing it, Mr. Speaker, we saw 383 days reduced to 90 days, Mr. Speaker. That is the work, Mr. Speaker, that's ongoing in healthcare. Mr. Speaker, it sometimes saddens me when I guess somewhat I'm in the social media age, Mr. Speaker. And when I go on social media, I see things, these abhorrent things of a few of our people in the diaspora who claim to be clinicians, Mr. Speaker. And they're offering untruths so casually and saying, Mr. Speaker, things like there are only 2 surgeons in Dominica. Mr. Speaker, in ophthalmology alone, Mr. Speaker, we have 3. 2 of them, Mr. Speaker, are Dominicans. One I went to school with, Mr. Speaker. And we're only talking about one area, Mr. Speaker. How can there be 2? But we have to be careful as a nation, Mr. Speaker, what tea that we drink. Because it's easy to drink that tea when the person maybe has the gift of gab or gift of speaking, the gift of convincing, and you're in your car and you just go on live, Mr. Speaker, and you have a following. It's easy for these things to stick, but it's not true. So we should not listen to Facebook Live and TikTok and Instagram and come in this house and offer it as facts. It's untrue. And I really ask, I implore that you support us in this Ministry of Health. We need your help too. We need the help of everyone, Mr. Speaker, for our healthcare system to continue to improve and make much needed gains, Mr. Speaker. Mr. Speaker, in terms of surgeries, Mr. Speaker, in the initial 6 months of this year, Mr. Speaker, over 1,091 surgeries, Mr. Speaker. But out of that, what we saw is many cancellations. So when people are saying, I had this surgery scheduled for that day and I was not able to, we have a lot of interruptions, Mr. Speaker, in our surgical departments. Because when you have 290 cancellations out of 1,091, can you imagine the problem? And what we're seeing, in fact, Mr. Speaker, a lot of these cancellations are, in fact, a direct result to the NCDs that we spoke about. You will have someone who's asked to come into the hospital on Monday, Mr. Speaker, to prepare for surgery on Tuesday. And the blood pressure, Mr. Speaker, is in the sky. And they cannot perform that surgery, Mr. Speaker. This is what we are seeing. This is what we have to contend with. But preparations have already been made for that surgery. And it throws off things, Mr. Speaker. So who do you blame at this point for your blood pressure being in the roof, Mr. Speaker? Is it the hospital at this point, Mr. Speaker, who were prepared? Or is it your lifestyle, Mr. Speaker? And I don't want to be too hard on our people because there are some factors that we absolutely cannot control, Mr. Speaker. By way of genetics, we are predisposed to many things. And even as people of African descent, we're predisposed to more things, good and bad. But health-wise, I see a lot of things are not necessarily in our favor, even though we are strong people. But we have to do better, Mr. Speaker, and not be too quick to blame and cast aspersions and try to make, Mr. Speaker, a speck of sand, Mr. Speaker, from Sand Bay or Middle Bay in Marigot look like it is a mountain. Let's not do that. Mr. Speaker, I can go on and on about the gains because I have the facts, Mr. Speaker. We keep records in our ministry, Mr. Speaker. We have it, Mr. Speaker. Let's talk about our diagnostic and imaging department, Mr. Speaker. And we have our good people like
20 more
Janice
minutes.
Fiscal, Mr. Speaker. And Mr. Speaker, in last year, we talk about 3,142 ultrasound scans, Mr. Speaker. You hearing that, Mr. Speaker? 2,665 CT scans. Our equipment working, Mr. Speaker. It's working. 30 fluoroscopy studies, Mr. Speaker, and 15 HIFU cases, Mr. Speaker. This is what we're talking about. If I were to give marks, Mr. Speaker, I would give the imaging department 95%, Mr. Speaker. And we know we have had some challenges, we'll admit, in preparing the reports with the experience that some people would like, Mr. Speaker, but the world is going for a problem by way of radiologists, Mr. Speaker. And poor Dr. Frutos, who has been working so hard for a long time, Mr. Speaker, trying her best. Government supported her, Mr. Speaker, by providing high-definition monitors at a home to even assist. This is what we're doing. And reaching out to various countries for radiologists to help us. This is what we're doing. I would like to take this opportunity to encourage a lot of our people, our young people, to specialize in that area. Instead of criticizing, go and encourage someone from Salisbury or Marigot to become a radiologist. They'll be hired before they finish. Mr. Speaker, we have a challenge of nurse attrition, and that is not only for Dominica, but it's a global problem that we have. What we're seeing, to a large extent, many clinicians are leaving the USA, the great USA, Mr. Speaker, and the great UK, and they go into the Middle East, Mr. Speaker. Saudi Arabia, Qatar, many countries. And what you see is a void in the great USA and UK, Mr. Speaker. And our own nurses and doctors in the region are then moving to UK and the USA to fill that void. And we also, too, naturally, will have a void. So those very patriotic ones who are here, Mr. Speaker, the work is left to them. But we are committing to them, Mr. Speaker, that we will do our best to retain them and to appreciate them, Mr. Speaker. We are committing wholeheartedly to that cause, Mr. Speaker. And we have started already, Mr. Speaker. When you look at the reforms that will be made, Mr. Speaker, by way of public service reform, Mr. Speaker, I'm excited and optimistic about what is to come. Because clearly, Mr. Speaker, we'll see that if we have a nurse, for example, on the lower end of the scale, Mr. Speaker, immediately when they move, Mr. Speaker, to the next salary scale, you can see an upgrade and increase in the salary, Mr. Speaker, by $1,019.79, Mr. Speaker. So, Mr. Speaker, I mean, when we hear of collective bargaining agreements, Mr. Speaker, and we hear of negotiations by unions and so on, we have come to hear things like 1%, 0%, 2%, 0%, 0%. One time, Mr. Speaker, one shot, Mr. Speaker, September 1st, Mr. Speaker, this Labour Party government is telling the public officers of Dominica that we're not in that 0% thing, we're in that 6% to 13% business for all public officers, Mr. Speaker. And I am excited about that opportunity. Mr. Speaker, by way of healthcare financing, Mr. Speaker, you would have heard that the Minister of Finance, he spoke about the policy that we've had and the slight policy. I won't in fact even say a slight policy change, because it was always the intention of the government to do that. And I speak to having insurance companies paying for services offered by a hospital, Mr. Speaker. That's what I speak to. And Honorable Dr. McIntyre did say that from speaking to various insurance companies, and they're the ones coming to us and saying they're spending quite a bit of money overseas for people in all age demographics. And I'm talking about 18 and below, 18 to 60 and above 60. Many people are in fact insured. This is what they're telling us. They've volunteered that information. And they're saying they have this money and they're willing to pay if they are charged, Mr. Speaker. So what we'll do, Mr. Speaker, is to continue to consult, Mr. Speaker, and then effect an adjustment. So what that could mean, Mr. Speaker, say you were to have a young child, say 8 years old, Mr. Speaker, and this child is insured and has 80% coverage and goes to the hospital and you're charged $250, I believe. That's the neonatal ICU cost for 1 day, $250. Mr. EC, what that means, therefore, Mr. Speaker, that if your child is insured, the hospital can then charge the insurance, Mr. Speaker, not you, the insurance, the 80%, if they're insured for 80%, Mr. Speaker. So they will charge the insurance company $200. And the co-pay, that 20%, so that's $50, the other $50, the government will waive that fee. So this won't change your circumstance at all, Mr. Speaker. And for clarification, if the child is not insured, we'll maintain our policy, Mr. Speaker, in keeping with universal healthcare access. And there will be no charge for your child if your child is not insured, Mr. Speaker. Mr. Speaker, just finally, I want to speak to the security and tenure of our good people at the hospital. As you would know, we have moved over to an authority, Mr. Speaker, and that happened 2 years ago.
12 more
And
minutes.
thank you, Mr. Speaker. We moved over to an authority 2 years ago, and I'm reporting also that we had to second all our staff, Mr. Speaker, from the Dominica China Friendship Hospital, Mr. Speaker, over to the authority. And this was done for a 2-year period, and that 2-year period actually elapsed yesterday. And what we, based on our interactions with them, many of them were concerned about the security and tenure and the terminal benefits. So what we've done as a cabinet is to extend that time period by 1 year, Mr. Speaker, to allow for proper discussion and dialogue with them so they can clearly understand what has happened. Mr. Speaker, it was never government's intention to put any of our staff at the hospital in any unfavorable situation or position. This has been done already by the government successfully with the staff of the Dominica State College, and it's the same process, Mr. Speaker. No one will be out of pocket. No one will be in any worse position, Mr. Speaker. This is our absolute commitment to the people and the 600 workers that we have at the hospital, Mr. Speaker. So we'll continue that process. And I'm guaranteeing them, Mr. Speaker, that they will be fine. Mr. Speaker, I wish to also thank, while I'm on this secondary healthcare sector, the board and the management and staff of everyone at the hospital, Mr. Speaker, who have really been doing their best in a difficult transition period where we changed the way that the management, Mr. Speaker, is conducted, the affairs are conducted at the hospital. And this is a transition period that has had its challenges, and we often take that for granted. So I want to express my sincere thanks to them for the good work that they have been doing. Mr. Speaker, in conclusion on healthcare, Mr. Speaker, I wish to reflect on our absolute commitment to the good people of Dominica and to let people know, Mr. Speaker, that the quality of care that they receive is our primary preoccupation. Accessibility of our care is our preoccupation, Mr. Speaker. Mr. Speaker, we are not perfect as the ministry. We are not perfect as individuals, Mr. Speaker. But I promise the nation, I commit to the nation that every day, Mr. Speaker, the majority of our healthcare personnel, they do their best, even with the limitations, Mr. Speaker. Of course, there are opportunities for improvement, and so we will do. And I commit also to, Mr. Speaker, to ensuring as minister that individually and collectively we are more responsible, Mr. Speaker, for our actions. And we are in fact taking steps to do just that. As I have said before, I am happy and honored to be the general, Mr. Speaker. And I look forward to the wonderful gains that we'll continue to make in this great ministry of health, wellness, and social services. Mr. Speaker, my blessed constituency, and I'm sorry that I have to feel so rushed, Mr. Speaker. Never in my life, Mr. Speaker, and I say so because I have been a consummate science student, and I thought I had an affinity to business also, that I thought I would be involved in politics. I thought I had my story written, Mr. Speaker, but as the good Lord would have it, there came a point in my life in 2019 that He destined, Mr. Speaker, that my path would cross and intersect, Mr. Speaker, with this great Labour Party in service. And I stand proud and honored and absolutely committed to represent my country and my community, Mr. Speaker, on behalf of this party and on behalf of this government. And also too, Mr. Speaker, it is in fact one of the greatest honors of my life, and I say this now, Mr. Speaker, because I don't want to make the mistake later in my life for me not to show the appreciation that I have for the great leadership that we have been blessed with, Mr. Speaker. A prime minister like Honorable Roosevelt Skerrit is a once in a lifetime, once in a generation, Mr. Speaker. Mr. Speaker, we know, in fact, because he's not new to this business, for over 20 years, that history will record him, Mr. Speaker, as a prime minister who has faced the greatest adversity, Mr. Speaker. But even with that, Mr. Speaker, time and time again with his leadership, we would rise from the ashes, Mr. Speaker, and achieve even greater prosperity, Mr. Speaker. So I am happy and I am honored to be working very closely with him and learning from him also, Mr. Speaker. And I'm happy for the opportunity granted to serve my people. For the 2,000 plus people who elected me to serve them, I'm extremely grateful. From the bottom of my heart, I say thanks. And everything that I do is in absolute commitment and service to you. Mr. Speaker, I am not perfect. I learn as I go along. I never went to school to be an MP, a member of parliament, but I try with every blessed opportunity that I have, Mr. Speaker. And I embrace the wisdom of my mistakes, Mr. Speaker. And I promise my good people of this great Mao constituency that I will leverage on all of my strengths. So at the end of the day, it will be a win for all of us. Mr. Speaker, while I stared to my right, I made eye contact with one of my constituents, Mr. Speaker. And maybe I wasn't bright enough to realize that this would have been in my life story. And I speak to Miss Esprit, Mr. Speaker, or stenographer. Because a few years ago, I was president of a Holy Family Church group, of which she was a very active member. And I was a good president, Mr. Speaker. We used to do a lot of things, Mr. Speaker. We used to remix even secular songs and make them holy, Mr. Speaker. That's what we used to do. And Mr. Speaker, I remember my first little job, Mr. Speaker, so this is really not new when I think about it. My first little job working at the bank, right before I went to study. And as a church group, we wanted to attend a youth rally. And of course, we didn't have the money, and I offered, Mr. Speaker, because we had little time to raise funds, I offered to pay for the shirts, and they would pay me back. Most of them paid back, Mr. Speaker. But it was okay. We went and we represented well, Mr. Speaker. So today, Mr. Speaker, I am absolutely happy and thrilled for the opportunity to serve. And at this point, Mr. Speaker, before I go any further, I want to recognize the hard work, the body of work that I have benefited from, Mr. Speaker. And I speak to Honorable Blackmore, Mr. Speaker, because Mr. Speaker, quite, you could see the dressing. You can see the dressing, quite a flamboyant character, Mr. Speaker. Okay, but no, he didn't leave that one for me. I'm a little more modest. Okay, I boast in my own way. That's it. But Mr. Speaker, whether you like him or not, Mr. Speaker, no one can argue that no power rep in the history of this Mao constituency has worked harder on behalf of their constituency, Mr. Speaker. I just want to recognize it. And I have the opportunity now, Mr. Speaker, for much of the infrastructure that was done or created under his watch, Mr. Speaker. I now have the job to operationalize them, Mr. Speaker, and make the best use of them as a community and a constituency. And I'm happy to do just that. Mr. Speaker, I heard one of the members on the other side speak to the grandeur of our fete that we had and how there was no fete in a community on that weekend and how we should have had a fete, Mr. Speaker. But I don't even know how she knows they didn't have a fete because she was in my fete, Mr. Speaker. She was enjoying herself in Mao, Mr. Speaker. So she, Mr. Speaker, she don't even know what was happening by her, Mr. Speaker. But anyway, welcome her next year, and I was happy to have her celebrating with us. Okay? Or maybe she came there to fool a couple of us who would give her too much blows, Mr. Speaker, and exercise some sympathy. But back to our constituency. But this fear, Mr. Speaker, why we try to trivialize this fete and these festivals, Mr. Speaker.
I suspect you need some more time.
Mr. Speaker, I move that the minister be granted an additional 10 minutes.
I second the motion, Mr. Speaker.
It has been moved and seconded that the Honorable Minister be given an additional 10 minutes. Those in favor? Those against? The ayes have it. Honorable Minister, you are given an additional 10 minutes.
Mr. Speaker, thank you for that, because if I were not granted that time, I would not be able to retrieve my COE, Mr. Speaker. So thank you. But Mr. Speaker, we sometimes trivialize these important activities that we have. But these fairs, these festivals and feasts, it's a wonderful opportunity to build community and bring them together, Mr. Speaker. We know that in many of these feasts, they are partly religious and partly secular, Mr. Speaker. It's a wonderful opportunity to be together, to raise awareness about the community and to also create enterprise and an opportunity for many of our vendors. I spoke to some of the vendors in our community, Mr. Speaker, and one of them, after being part of the activities on Saturday night, I woke up very early and I was in Mao at 7 looking at the site to ensure that it was clean, and I saw her walking, Mr. Speaker, and it's in a positive way, so I can call her name Heather, Mr. Speaker. And she said, I made some losses from the cricket because I invested heavily, and I thought it would be 5 days, and it wasn't. So I'm really looking forward to this activity, Mr. Speaker, to make some money, Mr. Speaker, and recover from these losses. And from speaking to her again, Mr. Speaker, she is in a good place, Mr. Speaker. So that is what this is about. That's what it's about. And also to my style of leadership, Mr. Speaker, community is one of inclusion. It's one of involvement. It's not about me, my interests, and my personality. It's about the people. And what this does, it was an opportunity to bring a lot of people together. Mr. Speaker, since Carnival, we have had a group of people meeting every Thursday to discuss our activities. Big group of people, Mr. Speaker. So it's them. It's really not about me. And I supported Mr. Speaker very heavily, but I did it from a slight distance. Because I did not want to include politics, even though politics is not a bad thing, Mr. Speaker. But I just tried to be the community person that I am. And when we had the launching, Mr. Speaker, never would I have imagined when we launched our activities that would have been the highlight. And we had non-supporters saying publicly of our government, publicly, how pleased, how inspired they were by the power to allow them to have their say, Mr. Speaker. Mr. Speaker, we are about representation on this side, Mr. Speaker, and I am absolutely committed to that. We even had one of them apologizing, Mr. Speaker, one of our members apologizing, saying that at the end of this, he has changed his feelings about me, Mr. Speaker. And I hope to work on him a little more, Mr. Speaker. And when the thing come in 2025 or whenever, Mr. Speaker, we'll see what happens, okay? But Mr. Speaker, I want to thank sincerely all of them who worked with me, worked on behalf of the committee, Mr. Speaker, even the police who ended our activities in a strange way. I want to thank them because there were no incidents, Mr. Speaker. So I want to applaud them sincerely for the hard work. And that's Blackmore's team. Yeah, well done. Mr. Speaker, there are so many developments in our community, Mr. Speaker, in the area of music. We've been doing a lot. We've been working very closely with one of the foundations for music that promotes and advances music. And we have received some acoustic guitars and bass guitars, Mr. Speaker. And we're going to commence a program starting in September. It's later this year, Mr. Speaker, so we can teach many of our young children acoustic and bass guitar. So I'm excited about that. And we know that in this Mao constituency, Mr. Speaker, we are known for Kadas and Vince, don't get jealous now, man. We know we are well known for Kadas, Mr. Speaker. So we are happy for this opportunity to create these opportunities so our young children, our young people can have that opportunity to advance in the art forms, Mr. Speaker. I wish to, at this point, congratulate also the recipient of Golden Drum Award, Donald Blackmore, Mr. Speaker. Someone, if she wanted a recommendation, she could have gotten it from me, Mr. Speaker, because again, in our youth group, I remember we reenacted the Passion of Christ, and she was our director, Mr. Speaker. So Donald has been committed, Mr. Speaker, has been for quite a long time. Mr. Speaker, in the area of sports, we have made a lot of gains. Even tonight, and I invite you all, if we end early, we have 2 finals in the facility, the indoor facility in Massa. And guess what, Mr. Speaker? It's the finals for First Division basketball and the Premier Division, Mr. Speaker. And in both games, you have Blazers playing. So we have a team in First Division and one in Premier, Mr. Speaker. So there's a chance that if we win First Division, Mr. Speaker, I wonder if we'll have 2 teams in Premier, Mr. Speaker. That is the talent that we have in Massa and in our community, Mr. Speaker. But we won't do that and deprive a team in Trafalgar an opportunity. All right, Dr. Mark? So we might instead just beef up our Premier Division team. In the area of cricket, Mr. Speaker, we have played cricket for the most part in the community in Tiza and also to, DCP Sports Center, which really, in fact, is a private facility. And we've been working with, some of our good friends, Mr. Speaker, and we have a commitment from one benefactor, Mr. Speaker, Ivo Nassif, who is willing to allow us, again, the use of that field for the community and to also invest in cricket facilities, Mr. Speaker, the nets and so on, so that we can continue to develop and nurture the talent of our young cricketers in our Mao constituency. So we're grateful. Playing fields, Mr. Speaker, that has been a challenge for us in our community for a while. We have some of our sites, and to a large extent, many of them would have been changed, particularly after Hurricane Maria. One of them was actually used as a dump site. That's the one in Canefield I speak of. And we started cleaning this site. We have done about half of it, and that would have been sometime in December of last year, Mr. Speaker. Just last week, I would have provided one of our constituents who has heavy equipment with 2 drums of diesel to continue the work. And these are people who come forward to do work on behalf of the community. And I speak to Jerry, Mr. Speaker. So we are continuing the efforts. But also, too, I want to make it clear, we have some companies out there, Mr. Speaker. And I mean, how are you showing good corporate citizenship when you take the generators and you just dump it, old generators, Mr. Speaker? And we almost seem like we are begging to have them removed, Mr. Speaker. I'm asking for all of us to work together. We do not want to lose a generation of footballers, Mr. Speaker, in our community. Mr. Speaker, there is an allocation, Mr. Speaker, for playing fields, and just like many of my colleagues, I don't expect to get all, neither am I asking for all this year, but to get some, to rehabilitate some of our fields, like in Teaser and Warner, Mr. Speaker, and Campbell and Taro and so on, Mr. Speaker. And it's not too much. We will ask for lights at the right time, Mr. Speaker. We are not quite there yet, because we are further back, Mr. Speaker, in that area. We need to first develop our fields. But what we'll do, Mr. Speaker, we won't even ask for lights, because what we'll do is to prove that we need lights. Because when we start to play, Mr. Speaker, and we see that our young people are playing till dusk, Mr. Speaker, I know my colleagues will come to me and offer me lights, Mr. Speaker. So that will be my approach. Mr. Speaker, in the area of culture, you know, this constituency is buzzing with culture, and I've used some of my time the first 6-7 months, Mr. Speaker, to meet with some of our groups. And one of the, well, I could say two of the groups that stand out in particular, Mr. Speaker, we have a group in Warner, Mr. Speaker, and they're a musical group, Mr. Speaker, and we usually see them coming out in November, Mr. Speaker, and playing the gouache, Mr. Speaker, and so many other instruments. And we saw that development that's happening in the area of culture.
2
And also
minutes.
to our Jaffa cultural group, Mr. Speaker, I've met with them already. This one is in Massa, Mr. Speaker, and we're working closely with them to ensure that they continue and do their best to enhance and advance culture. Mr. Speaker, we have a big constituency, big ministry. I know I got a lot of time, but I will not take you all for granted. There's a lot to say. And what I can say, though, is we have started a series of town hall meetings for constituents, Mr. Speaker. We were interrupted by Tropical Storm Brett, but there's a lot in place, Mr. Speaker, for our constituency. And if we just go a little deeper, a little further in the remarks from some of our colleagues, like Honorable Defoe, Mr. Speaker, to report that we have near $600,000 allocated for fisher folks in Mao to improve the landing sites, Mr. Speaker, and to give us 10 stalls, Mr. Speakers, and we deserve it. These are some of the plans that we have, and I will never forget, Mr. Speaker, and I'll never take for granted also the work, the good work that we are doing for and on behalf of the good people of Cambia. And I want to express in a special way gratitude to the Ministry of Housing in this regard, Mr. Speaker. So I know sometimes it's easy for us to say that I didn't get, you didn't get, Kulibistri didn't get. Mr. Speaker, in 2007, I lost my dear friend Juliet, Mr. Speaker, and her daughter in a slide after Hurricane Dean, Mr. Speaker. And we have been patient. The people of Campbell have been patient, Mr. Speaker. And I've been gaining their trust through this process. And the Ministry of Housing, they've been standing with me, Mr. Speaker, to make that dream become a reality. And I'm thankful to the government of Dominica, Mr. Speaker, for making available 4 acres of land in the first instance, Mr. Speaker, for 50 homes for the first phase, Mr. Speaker. So I'm grateful on behalf of the people of Campbell. Mr. Speaker, there's a lot more to say, Mr. Speaker.
30 seconds.
I just wish to take this opportunity sincerely to thank everyone, Mr. Speaker, who has supported me. And Mr. Speaker, even those who have not supported me, when I'm finished, Mr. Speaker, I hope after my body of work, Mr. Speaker, after they witness my commitment, Mr. Speaker, we can at least share mutual respect for one another, Mr. Speaker. Mr. Speaker, I'm grateful to all of the hardworking staff at the Ministry of Health, Wellness, and Social Services. Mr. Speaker, P.S. White and P.S. Baptist, Mr. Speaker, these people are absolutely committed to what they do. And all the administrative staff, Mr. Speaker, every single one of them, Mr. Speaker, I am grateful for the hard work, Mr. Speaker. I'm thankful also for all our staff in primary healthcare and secondary healthcare, Mr. Speaker. Mr. Speaker, the board, our new CEO, the management, everybody, Mr. Speaker, I'm grateful. The domestics, the lab techs, every single one of them. I'm forever grateful. And finally, Mr. Speaker, I wish to say thanks also to the great people of my constituency, my LYO, my LWO, Constituency Association, the executive, Mr. Speaker, and all our special committees. Everything that I do is for and on behalf of you. Mr. Speaker, thank you sincerely for the opportunity to deliver these brief remarks.
Mr. Speaker, pleasant good afternoon to you and to everyone in this honorable House. Normally at this point in time, Mr. Speaker, the Minister of Finance would rise to wind up, as well as, to give his rebuttal. But, well, looking forward, I'm not looking forward to it because this is a new opposition, so I thought that would be very exciting. But this budget was so well thought of, it was so progressive, visionary, well fitted for the times, so there wasn't really nothing left for the opposition to give ideas, suggestions, etc. But nonetheless, we have to clarify a few things, though, Mr. Speaker. As a matter of fact, when Honorable Dr. Vince Henderson gave his presentation, I actually forgot everything that was said by the leader of the opposition. And I had to resort to GIS so that I could find out what was said. And that I did, because I just wanted to find out what was said. It got lost somewhere after the presentation by Honorable Henderson. But let me not waste too much time on this, Mr. Speaker, because it was just about the usual electoral reform, the usual lack of attention for Salisbury, which I didn't think that was the correct approach at all, considering it's a new opposition. But there are a few things, though, I would want to clarify. Senator Henderson Reid from Marigot mentioned about us taxing the savings of Dominicans at the credit unions. That is just totally incorrect. Mr. Speaker, you have to understand you have to contextualize things. You have to see what's happening in the international financial space. And Dominica is a signatory to many of the conventions. And, we are bounded to the IMF and the World Bank by just being signatory to these conventions and being part of these international financial institutions. So, and we know the sort of risk associated with the financial institutions in the sense of money laundering, in the sense of terrorism financing. And since we are part of this global family, and in terms of the security and in terms of just our peace in this global family, we have to make sure and we're obliged to be part of the procedures and the processes of remaining free from those criminal activities. And it cost us quite a bit because for us to remain off the blacklist and the grey list, we have to comply. And for us to comply, we have to, in terms of our staffing at our financial investigation unit, in terms of our staffing at the financial services unit, in terms of our staffing at the Inland Revenue Division, in terms of our staffing at the Registrar for Companies, in terms of the IT and the security-related commissioning that we've been doing. All this costs money, Mr. Speaker. And Mr. Speaker, also, you have to look at it when the teams come down, whether it's from IMF, whether it's from World Bank, whether it's OECD as the Organization for Economic Cooperation and Development, when they come down from FATF, as the Financial Action Task Force. We have to host these people. This is more expense on us, Mr. Speaker. So here we are, the Ministry of Finance, we have to supervise and we have to regulate all the financial institutions, but it comes at a cost to us. So, Mr. Speaker, all we did was to put the license for the credit unions. And not just the credit unions, we had many other financial institutions that rather than put it on the citizenry, rather than put it on the Dominicans with direct taxes on them, we went and we got it through these financial institutions, Mr. Speaker. So when you look at it that way, it wasn't taxing the savings of Dominicans. It wasn't. It was just a license that we're putting on the credit unions, Mr. Speaker. And you have to also appreciate that this regulation and this monitoring, it's all for the benefit of the credit unions. And it's all for the benefit of us staying off this blacklist and grey list. It's all for the benefit of us being able to function within the international financial space. Because if we're on those lists, you know what happens next. And it'll just be bad news for us in terms of people wanting to do business with us and transactions with us. And if you were to look at it, the amount that we're talking about, Mr. Speaker, it's basically a drop in the bucket. Because take, for instance, if you permit me to refer to my notes, if that's okay, Mr. Speaker.
Permission granted.
Yes. So, Mr. Speaker, for instance, we have, when we look at the assets of the different credit unions functioning under the league. So, for instance, National NCCU did have about $737.9 million in assets. And all we're asking for is $100,000. So, Mr. Speaker, that's even less than $10,000 per month. Now, to put this into context, you have to realize that the credit unions are paying $300,000 for governance, Mr. Speaker. Just for governance. So what that means, that's $300,000 for director-related expenses. And we're just asking for $100,000, Mr. Speaker. You have to put this into perspective, Mr. Speaker. Put this into perspective. We're asking for $100,000 because they're above $500,000 in terms of assets. And governance, credit union pays to the league governance, that is director-related expenses, it's $300,000. So, Mr. Speaker, you get the point that I'm saying. If it were other financial institutions, they would have to pay $120,000 for license, $20,000 for additional branch. That's already $140,000. And they would still have to pay 25% cooperative tax. So, Mr. Speaker, you recognize that when the customers move from these banks into the credit union that doesn't pay corporate tax, the government gets absolutely nothing. If it were a commercial bank, we'd get the license of 120 plus 20 per branch plus 25%. So, for instance, if we look at the surplus, but simple terms, the profit of the credit union, $4.9 million in profit, 2022. What does the government get? Nothing. If it were the banks, we would get $1.2 million. So you see, Mr. Speaker, what we're talking about is a drop in the bucket. And when we talk about how this is going to affect the common man, NCCU, let's say, for instance, that need to pay $100,000 with 68,057 members, it would work out per member at 12 cents per month. 12 cents per month. That's what it would work out to. And if they decide to pass it on to the customers, but I know the people, they will not do that, Mr. Speaker. They won't do this. And permit me to say, reliable sources have told me that the league brought out this letter without consulting all the credit unions. As a matter of fact, two of them have just dissociated themselves from this letter. That's not good, Mr. Speaker. So, to Senator Reid, I think it could have been just genuine ignorance. That's okay. Or such dishonesty is legendary. Mr. Speaker, this House, oh, here we go. Mr. Speaker, this is not what this House is all about. When we come in this House, as my elder brother would say, it's serious business. But Mr. Speaker, and the sort of services that we are talking about here, if we look at it, over the past 10 years, not one credit union has made a loss over the past 10 years. A bank, NBD, in the hard times, made losses, not the credit unions in the past 10 years. And Mr. Speaker, the credit unions of today is not what it was in the 1950s, where you had filing cabinets in somebody's drawing room or in their living room. No, this is a different time, Mr. Speaker. It's a different time. They might have a slight different structural, might be different structurally banks or the commercial institutions, but nonetheless, it's the same portfolio that they're offering. They're actually offering the same things, like all the banks. So we should not get too carried away with the misinformation and the misrepresentation of the facts. I thought that was being very, very dishonest. This is not what this House is all about. And but I guess we all make mistakes at some time or the other. The only true mistakes we make, Mr. Speaker, are those we don't learn from. So let us hope that the senator learns from this mistake. We actually forgave about the mandatory DNA testing. We leave that out. So, but so this is strike number 2. This one here. So yes, we counted. Although we don't play baseball here, nonetheless we're counting. Anyway, Mr. Speaker, let's move on. Even the senator, the other senator from Salisbury, spoke about us just reacting. So it's a lorry, sorry.
Yeah, if you don't.
Us just reacting and then criticizing and saying that we're not being prepared and we lack that resilience. Mr. Speaker, this cannot be more untrue than ever. This government has embarked on so many different measures so that we can be a resilient nation. If anything, Mr. Speaker, Dominican resilience is not synonymous. When the world talks about resilience, they refer to Dominica. No doubt, well, it doesn't surprise us that recently international organizations will come here to find out what CREED was doing. That's our Climate Resilience Execution Agency of Dominica. They didn't come here because we didn't have the resilience. They didn't come here because we didn't have the knowledge. We have the experience, we have the knowledge, and we've been doing what we ought to do to become the first climate resilient country in the world. So when Senator Laurie spoke about this, it was very disheartening. But let alone the resilience from a climate point of view, this government has been building resilience even from a financial point of view as well. Fiscal resilience. Mr. Speaker, look at it. If you look at it, our vulnerability risk and resilience fund, which we capitalize from the CBI of $500,000 every month. We're actually at $17.2 million. That is preparedness, Mr. Speaker. I don't know how she could have said that we're not preparing. And that's just one instance. Mr. Speaker, we can go further. The catastrophe bond of 20 million secured from the World Bank. That is being prepared, Mr. Speaker. And we can still go further, Mr. The flexible hurricane protection parametric insurance at the credit unions, which the farmers can subscribe to. All that is being prepared, Mr. Speaker. Mr. Speaker, we can even go further. And we have increased our contributions to CCRIF, that is the Caribbean Catastrophe Risk Insurance Facility. We have increased our contributions, insuring the country against these climatic events, Mr. Speaker. That is the preparedness that is taking place, Mr. Speaker. Mr. Speaker, our risk financing strategy with the World Bank. Mr. Speaker, our disaster financing action plan we do with the IMF. Our debt repayment fund of 5,000 per investor in the CBI. And the list goes on and on and on. That is the preparedness that this government is engaged. This is what resilience, the entire budget that I delivered is riddled with resilience and sustainability. Mr. Speaker, we can even go further. Infrastructure, that's just the financial part. But since we're on resilience and, she mentioned that, just go a little further. In the region, Mr. Speaker, we have the most resilient housing stock in the region. There's no question about that. All the different apartments, the homes we're building, they're all climate resilient, Mr. Speaker. Hurricane Maria came and you saw our bridges remained. That is resilience, Mr. Speaker. Well, I hear the countries talk about they lost the bridge and they have to build it back and they lost it again and they have to build it back. No, when we build, we build. That is resilience, Mr. Speaker, in terms of our infrastructure. Mr. Speaker, all of this month we've been seeing hurricane ties being distributed in all our constituencies, Mr. Speaker. That is resilience. That is being prepared. That is the preparedness that we're talking about. She's absent from the house now, but let's continue. She must be listening somewhere. And then, Mr. Speaker, look at our disaster, our shelters that we built, the one in Jimit, the one in Cassibrus, and all over the country, our resource and hurricane shelters that we have. Mr. Speaker, the busiest chats on my phone are the disaster preparedness committees. And you have to look at it from the point, they're volunteering, but it's just how much they enjoy doing what they do, because they see the bigger picture. This is love for country and getting prepared. And they're forever there. And we have to give praise to the ODM for that in organizing all these different trainings all over the island for all the disaster groups. Job well done. Job very well done. But we can also go further our resilience efforts, Mr. Speaker. Take, for instance, in health. All these climate resilient health and wellness centers we have all over the country. Mr. Speaker, look at the surveillance Honorable Abil spoke about, where we can have real-time PCR testing for reboviruses. That's all part of the surveillance so that we get prepared if there's another pandemic. So that we never had to send to CAFA, but even now, with this RT-PCR testing for arboviruses, it's done right here. Not in other islands like this, Mr. Speaker, in the Commonwealth of Dominica. That's what happens. Mr. Speaker, even our resilience in terms of what we do at the district. So besides you have the climate resilient structures, even the water harvesting and the water storage, even the generators and the diesel that's available, even the treatment available for all our chronic illnesses that can even get treatment for 3 months supply to tie them through the hurricane season. This is what's going on. This is the resilience of this country. So last year, when the OAS had to have a convention and a conference on resilience, who they choose, Mr. Speaker? The Commonwealth of Dominica. And they were very pleased with our presentation, and that's why they chose us. It was held at, Intercontinental now. On the entire Latin America and the Caribbean, the country they chose to talk about resilience, the country with the best record was the Commonwealth of Dominica, and they came there, Mr. Speaker. But, Mr. Speaker, the Ministry of Finance obviously will handle it in two ways. We'll improve the government's fiscal position, and secondly, also to focus on our social protection. So this is what the budget has done. Granted, I won't go through all these different productive sectors that you mentioned, agriculture, tourism, etc., digital. I mean, we've spoken about that for the past few days. I think the Dominican public have understood and they have recognized that, yes, this is a budget for the times. It focuses on the productive sector. At the same time, it is not sacrificing all our social network programs that we have in place. Because we put the people first, the health for the people first, their well-being first, Granted, we provide all the jobs and the livelihood and stuff, but we also definitely keep our social, because we have to take care of our vulnerable. This is what this government is all about, taking care of the vulnerable as well. So, but moving ahead, Mr. Speaker, I have to extend my deepest thanks to all the staff in the Ministry of Finance. There are a lot of departments coming under us. I'm actually scared to begin naming them in the fear that I forget one, but obviously we have the Customs and Excise, we have the Treasury Department, we have the Inland Revenue Department, we have the Statistics Department, we have the VAT Unit. I mean, all of this comes under us, the Financial Investigation Unit, Financial Services Unit. We manage all of those things together. And I really must extend my deepest thanks to them. And above all, Mr. Speaker, our Financial Secretary. Hats off. Mr. Speaker, if it's one job I wouldn't want, it's the job of the FS. This is not an easy one, and she handles it well. So hats off. Mr. Speaker, let me just move on quickly to my constituency, and I want to say a real pleasant good afternoon.
Yeah, 1 more minute. Yeah, 20 minutes for rebuttal. Yes,
Mr. Speaker, I beg to move that the Minister of Finance be given 15 more minutes to complete his presentation.
Seconded, Mr. Speaker.
it has been moved and seconded that the Honorable Minister be given an additional 15 minutes. Those in favor? Those against? The ayes have it. Honorable Minister, you are given an additional 15 minutes.
Okay, that should do, Miss. That should suffice, Mr. Speaker. But let me say a real pleasant good afternoon to everyone in the Rosa Valley. I know you're all listening. Very loving people, Mr. Speaker. They have taken care of me, and I will definitely take care of them. They've been there with me in hard times, good times, bad times, but nonetheless, they're there with me. And they have been very understanding as well, in the sense that they have grasped the reset, the national reset, very well. And we know Rome wasn't built in a day. Things we have to prioritize. We have to see how we spend every dollar wisely, and we have to stretch every dollar and try to see how we can get the maximum out of whatever we spend. And they're fully aware of that. So granted, quite a few things have come their way, and there are many other things to come. Nonetheless, they are patient, and they will wait as we go along through these financial times. The truth is, Mr. Speaker, we're in a time of the polycrisis. We have climate change, we have the food security, we have crime as an issue, well, not so much in Dominica, but within the region, relatively speaking. We have NCDs going on. There are so many debt sustainabilities. There's a lot of things going on, and that is the backdrop on which we are functioning within this present time. So, for instance, my people in Loda, obviously, the Dominica Cable Car Company is coming. That is $54 million. This is good news for us, employment for the people of Loda, and we're really looking forward to the completion of that. So many of the young people within, not just from Loda, but from the entire Rosa Valley, are working on that project. And as I said last time, and I can say it again, when you go through the Rosa Valley during the course of the day, it's like a ghost town. Everyone is employed. Whether it's on the Dominica Cable Car, whether it's on the geothermal, they're farming, everyone is employed. Mr. Speaker, Dr. Henderson spoke about the geothermal project, and it's on its way. And I wouldn't really elaborate too much on that. Our sanctuary resort in Porvidas, a very good friend, you always visit there, and you see it's doing pretty well, so we cannot wait for this sanctuary resort to be, opened and stuff, and then so that all our farmers can benefit in terms of produce for the hotel, etc. And, it's just a lot of business going on there. Our playing field, there's a lot of work going on our playing field in Loda now. Actually, I must say, tell Mr. Libla thanks, some voluntary work to clear it off. And the government has made available, we've acquired an extra acre of land for the Loda playing field so we can get a proper size playing field for Loda. And so all now works are going on. In terms of our tourist sites, obviously the freshwater lake, we really have a great plan for there, Mr. Speaker, that when you get there, it'll be an experience you won't forget. That's the whole thing about our sites in the valley. We make it so it's an experience. You come there and you don't want to leave. You spend a day at the freshwater lake. That's the plan, and Mr. Speaker, we will pull it through. Lights for T2 Gorge. Initially, we had the solar lights, but obviously T2 Gorge, the area solar is an issue. So now we have some new contract coming to get signed soon for the and estimates have come in so we can get Domlec to get the lights there and stuff. The link road in Loda, it hasn't occurred yet, we cut it, but it will be done and it's on the card. As a matter of fact, Mr. Speaker, on Saturday we have a reggae night in Loda, so you can imagine the moonlight, the cool breeze, and the Monaco train doesn't get better, Mr. Speaker. Mr. If we come down a little bit to the next village, this is Trafalgar. Lots of housing programs going on there. We've had some apartments there. Been a little delay in the opening, but nonetheless, we iron out those little issues, and very soon we'll be opening them before the end of the year. And we have another 16 three-bedroom units being built in Trafalgar as well, handling and addressing the housing issue of the village, obviously. And obviously, the tourism site in Trafalgar, that we're going to upgrade as well. We have some work to do there as well, and estimates have been there, and then the contract will be signed. Our indoor basketball court, which was under BNTF, but you see the national financial crisis, finances were a little slow, but it will come through. So it's just a matter of time. We're high rainfall areas, so we must have indoor facilities there. Our digital hub, I must thank Honorable Laville, Honorable Roy, and presently Honorable Grant and Honorable Hippolyte, that our digital hub is jam-packed, it's filled, and it's functioning ready. We actually, it's really something that it's so much fun, Mr. Speaker, when you can see all these young students from different parts of the valley being transported to Trafalgar, they get into the hub and transported back home, safe environment. Mr. Speaker, you cannot ask for more. This is great stuff, Mr. Speaker. And that is all just investing in the youth of the Roseau Valley. Our playing field lights, that is a little outstanding, and we will get it done as well. Mr. Speaker, in terms of Mount Prosper, we look for the commissioning of the water supply in August 2023. And I'm very certain that with this, let alone the comfort of home water for domestic purposes, but I'm very sure the irrigation point of view, we will definitely see an increase in productivity of our farmers. We are a hard farming community in Mount Prosper, the village where I live and I reside in, and we've put lots of inputs for the farmers there, whether it's fertilizer and other different things like that. And then with the water for possible irrigation, that should spell very, very good news for the farmers of Mount Prosper. And it's interesting to know almost 75% of the farmers are women. So you can get the importance of all of that. Our basketball court was completed, and the bigger plan for the basketball court is obviously a basketball academy. I got a sponsor for this already, so it's just a matter of time for us to just put it together. Our football field, we need a little upgrade there as well, and we've been doing some, road repairs within the village. And for this, I must single out the chairperson, Ms. Decima Timothy Myers, and her team who work on weekends to fix up those roads. Hats off. Mr. Speaker, if you come down quickly to Wharton Waven, yes, we have some work to be done at the Castle area and the Castle Bridge coming from Wharton Waven. So we have a little bit of work there. The entire thing is about $2.8 million. But as I told you, they are patient people. We understand things. We know the situation now. It will come. We'll do it in phases. And that is what I love about the people of the Roseau Valley. They understand where the government is and what it's doing for them. So that will be done. We're going to start that pretty soon. We got some, we got Rainbow to come and take a look. We have all the other local builders and contractors who are going to be contracted on this particular project. Also in Wharton Waven, our playing field, we got a lot of assistance from the National Horizon Office of the European Development Fund. Ms. Roberts was very, very helpful. And now we have the grading of the field, we have the sloping of it, we're going to get the drains done, we're going to do 17 solar lights, we already have the benches built, so that's the playing field for Wharton Waven. And they have been so patient. They used to go to Trafalgar to play football, but now they see their field, it's happening. So they know this is a government they can trust. When you say we'll do something, we'll do it. It might not happen immediately, nonetheless, it will happen. So that is good news for us. Even the tourism site at Triangular and Wharton Waven, we've cut down on it in the sense that it was really $3-point-something million. So we're going to get the same thing, but for less. That is what efficiency is all about. This is what the reset is all about. That's what the reset talks about, Mr. Speaker, efficiency. So that's going to come through. And obviously we know we have the land separation. Remember we spoke about land in the budget here for persons who can afford to build a house, but the land is the limiting factor. So that is also part of the whole program. But obviously the Wharton Waven people, lots of the lots have been already surveyed, etc. And that will be dealt with within this financial year. Housing will come to Wharton Waven. Actually, we've done Cochrane housing, we're finishing with Trafalgar housing now, and then the next village is as well. We're doing some in Mount Prosper, the housing recovery program. We've got quite a few of them built there as well. So then after we move on to Wharton Waven and Loda, it's a gradual process, Mr. Speaker. They are patient and they understand what the government is doing. Mr. Cochrane, obviously, well, you know, we built our road to Cochrane long back, and that's been good. But, and earlier in this last financial year, there, we also gave quite a bit of assistance to the lighting of the Cochrane playing field, thanks to the Honorable Prime Minister, who was very generous in that regard, and the people of Cochrane were very appreciative of that effect for the light. Because football means a lot to Cochrane, Mr. Speaker. I know football means a lot to you as well. But as a matter of fact, just recently, some of the young Dominicans, I think quite a few of the constituents spoke about it, and there was a training session in, well, a selection session in Antigua, and quite a few Dominicans went there. And two of the persons selected for football scholarships to the State Fair Community College in Missouri were from Cochrane. And Mr. Speaker, that is Mr. Josiah Bodie and Mr. Jovan Matthew. So they'll both, at the middle of this month, they'll be both going up on their football scholarship to Missouri. And because football is a lot in Cochrane, the academy does a lot there, the middle arm team does a lot there, and football means a lot. So I'm really happy. The bigger picture for them, obviously, for Cochrane, is to acquire some land so we can have a regulation-sized field and we can even hold national games. That's the big picture. But as I said, gradually, little by little, we will get where we have to get there. Also, in terms of the agro-processing, we have the Women's Farmers Group in Cochrane, Julietta Richards, and 5 of the other women farmers. On the 9th, actually, we will be commissioning the pulping of the passion fruit on the 9th. And we got funds for this from the UNDP. Ministry of Agriculture is very helpful in that as well. So you can see farming is alive and well in Cochrane. And then this is the agro-processing part of the farming for Cochrane. Our summer school program in Cochrane went very well. It's still going on very well. That we have Leif Moses and Naidi running this program, and we're very happy. And Mr. Speaker, next year, you look forward to the Rabbit Festival. We're just preparing now. We're just setting the foundation. So next year, you will see this. If we come, well, we obviously completed all our drains in Cochrane, in Copthall, so that proper drainage. I remember the issue with Hurricane Maria. This will not happen anymore. And in Forkani, obviously, we want to get some railings for the bridge in Forkani. And I'm so happy that our Cabanis wall was built, and it was a great job done, Mr. Speaker. A very great job by Dominican contractor. It's a Greenaway, so we're very happy about that. On the 7th, Mr. Speaker, as part of the whole Fetkaichi and Fist stuff by Vados, I don't know if you've been to Vados Hotspot. At 3 a.m. we'll be starting. And we'll be starting at 3 a.m. on the 7th. And then on the same 7th, Mr. Speaker, at 4 p.m. in the afternoon, we'll be at Hecky's Bar for the wet fete. Now, Mr. Speaker, this is big man stuff. Children is not allowed at this one, at Hecky's Bar, and that's on the way to the falls, just before the hydroelectric. So that's going to be happening on the 7th. Start at 3 a.m., then we have the wet fete at 4 p.m., and it's going to have a lot of fun there. But Mr. Speaker, I would just want to say a special thanks to all my constituents again. I really appreciate that the love they showed for me is very comforting. And I also want to extend my deepest thanks to the NEP. They have done an excellent job in keeping the tourism capital of Dominica clean and neat, and that's great news for us. I want to wish all our students tertiary education. We've benefited quite a bit from that. As a matter of fact, very soon, at least 3 or 4 of our students from the Valley will be going to China to pursue tertiary education, and we're really grateful about that. And and all the other things that continue in small business. We benefited quite a bit from small business in Rosa Valley. I mean, we have bars and restaurants and all of it's littered all over the Rosa Valley. So you can just see. So, Mr. Speaker, you recognize that the Rosa Valley is bubbling, just like the rest of Dominica is bubbling. In these hard times, when you have a country that is bubbling like that, other countries, other people ask us, how do you all do this? Yeah. In these hard times, you have a country that is bubbling with activity. Projects going on. I mentioned so many of them in the budget. I'm not going to go through all of them, the marina and the airport and all of that. We've heard that, and it's going on. It's a fact. So I really want to thank the people and also my association, my constituent association. They've been really, behind me and supporting me, and I really appreciate that very much. So in a nutshell, I just want to say thanks to the people of the Rosa Valley, and I want to say thanks to all my colleagues here who helped in the whole budget preparation, and I think we did pretty well. The consultations we had before really helped us. That is why this is a budget of the people, because we consulted before we came with this budget, whether it's the farmers, whether it's the trade unions, whether it's the local government, whether it's the small business people, everybody was part of this, and everybody is represented in this budget. So it's really the budget of the people. Let us take the national reset really seriously. We've been doing excellent so far, but we are pragmatic government. There's always room for improvement. So that is why we're saying we're on track. Let's keep on track. I thank you, Mr. Speaker.
This concludes the debate. The estimate shall not be referred to the Committee of the Supply of the whole House. House resume. And I have to report that the estimate have passed through the Committee of Supply of the whole House without amendment. So the question is that the estimate for 1,234,524,036 as per the approved bill. Those in favor? Those against? The ayes have it.
Twenty 2024 Appropriation Act 2023.
The bill has been read the first time.
Mr. Speaker, I move the second reading of the bill shortly entitled 2023-2024 Appropriation
Act 2023.
Mr. Speaker.
It has been moved and seconded that the bill shortly entitled 2023-2024 Appropriation Act 2023 be read a second time. Those in favor? Those against? The ayes have it.
2023-2024 Appropriation Act 2023.
The bill now stands committed to a committee of the whole House to be considered clause by clause. House resumes. I have to report that the bill shortly entitled 2023-2024 Appropriation Act 2023 passed through the committee stage without amendments. The question is that I do report, is that the report of the committee and the bill be adopted. Those in favor? Those against? The ayes have it.
2023 be read a third time and passed.
It has been moved that the bill shortly entitled 2023-2024 Appropriation Act 2024 be read a third time and passed. Those in favor? Those against? The ayes have it.
2023-2024 Appropriation Act 2023.
The bill has been read a third time and passed accordingly.
Mr. Speaker, whereas by virtue of Section 3.1 of the Loans Act, Chapter 6405 of the 2017 revised laws of the Commonwealth of Dominica, the House of Assembly may by resolution duly passed authorize the minister responsible for finance to borrow money from approved sources or guarantee loans of statutory boards or public corporations for the purpose of financing general development purposes and for other purposes. And whereas, in accordance with Section 36(1) of the Finance Administration Act, Chapter 3602 of the 2017 revised laws of the Commonwealth of Dominica, the power conferred by the Loans Act to borrow money by means of advances from a bank may be exercised by means of a fluctuating overdraft. And whereas for the fiscal year 2022-2023, Parliament approved a bank overdraft limit in the amount of $108 million distributed as follows. Central government, $103 million, and guarantees to statutory bodies and public corporations, $5 million. And whereas these bank overdraft facilities were effectively managed and there were no breaches during the period. And whereas for the fiscal year 2023-2024, a sum not exceeding $102 million is required to assist with the operations of central government, which is $1 million less than the amount approved for fiscal year 2022-2023. And whereas the government proposes to increase the amount allocated to statutory bodies and public corporations from $5 million to $6 million to offer them flexibility in meeting their short-term financial obligations in a timely manner. And whereas the government of Dominica's debt strategy allows for a mix of financing options to include loans, overdraft facilities, and securities geared at meeting government's financial needs. And whereas the government of Dominica has utilized a combination of overdrafts and treasury bills to supplement general revenues to finance its short-term requirements and continues to finance its capital projects through grants, concessional loans, and resources from the Citizenship by Investment program. And whereas the government of Dominica continues to build fiscal resilience to macroeconomic shocks, the unanticipated shortfall in revenues, and the increased demand on the state to cover these unexpected events warrants the use of this facility. And whereas the government is also mindful of the ECCU target of having member countries meet the debt to GDP ratio target of 60% by 2035. Be it resolved that in accordance with Section 3.1 of the Loans Act, Chapter 6405 of the 2017 revised laws of the Commonwealth of Dominica, this Honorable House authorizes the Minister for Finance to borrow and guarantee by means of fluctuating overdraft a sum not exceeding in the aggregate 108 million Eastern Caribbean dollars from A, National Bank of Dominica, B, Republic Bank, and C, any other approved financial institution to meet central government's current overdraft requirements and to guarantee overdrafts to statutory bodies and public corporations for a further period of 1 year commencing from the first day of July 2023.
Mr. Speaker, I beg to second the resolution before the House.
Mr. Speaker, by virtue of Section 3.1 of the Loans Act, Chapter 6405 of the 2017 revised laws of the Commonwealth of Dominica, the House of Assembly may, by resolution duly passed, authorize the Minister for Finance, responsible for finance, to borrow money from approved sources or guarantee loans to statutory boards or public corporations for the purpose of financing general development purposes and for other purposes. Additionally, in accordance with Section 36(1) of the Finance Administration Act, Chapter 6302 of the 2017 revised laws of the Commonwealth of Dominica, the power conferred by the Loans Act to borrow money by means of advances from a bank may be exercised by means of a fluctuating overdraft. Mr. Speaker, though the government of Dominica continues to build fiscal resilience to macroeconomic shocks, the possibility of unanticipated shortfall in revenues and the increased demands on the state to cover these unexpected events warrant the use of an overdraft facility when it's necessary to do so. The government of Dominica's debt strategy allows for a mix of financing options to include loans, overdraft facilities, and securities to meet its debt management objective, which is to ensure that the government's financing needs and obligations are met on a timely basis in a way that minimizes cost over the medium to long term with a prudent level of risk. Over the past years, government has utilized a combination of overdrafts and treasury bills to supplement general revenues to finance its short-term requirements and continues to finance its capital projects through grants, concessional loans, and resources from the Citizenship by Investment Program. Mr. Speaker, as indicated before, the overdraft facility is not intended to serve as a permanent source of financing, but rather it will serve as a buffer that will offer flexibility in meeting the government's short-term needs in a timely manner. I wish to highlight that notwithstanding the difficult fiscal environment, government did not breach the overdraft limit for the fiscal year 2022-2023. Government continues to embrace the concept of sound debt management practices and to act accordingly. We will continue to exercise fiscal prudence in the management of the country's resources and will pursue due diligence in ensuring that the financing needs are met without losing sight of the Eastern Caribbean Currency Union's target of having member countries meet the debt to GDP ratio of 60% by 2035. I therefore seek the approval of the House for use of an overdraft facility with the commercial banks in the Commonwealth of Dominica in the amount of $108 million. $103 million will be used to facilitate central government's operations during this fiscal year, and $6 million is required to guarantee overdraft facilities to statutory bodies and public corporations for the fiscal year 2023-2024. I commend the motion to this Honorable House for its approval. Thank you.
The motion is before the House for debate.
Thank you, Mr. Speaker. Mr. Speaker, before I give my brief comments on the overdraft. Let me just say that most times that when we sit on this side of the house, that the public, the general public feels that we have to oppose to everything, and that we don't have anything good to say about the administration. But Mr. Speaker, sometimes we have to say it when it's good. As elderly would say that, laibo deibo. When it is good, say it is good. And it has been 7 months since I am the parliamentary representative for the Salisbury constituency. And I am very, very, very elated because I find myself in this position where I can assist people. People come to me at the office. And Mr. Speaker, they have a lot of concerns, people with different situations. And I sit and I listen to them. And many of them may think that I am part of that I am in the government and that I am a magician and I can make things happen overnight. But I do my best as a parliamentary, as a parliament for Salisbury. Mr. Speaker, there are times when we as the opposition, we have to make recommendations to the government as well. And when there are certain things that bills that are being passed and we are in support of, we give our support to them as well. Mr. Speaker, like she stepped out, the member for Roseau North constituency, she said she had a little story. One of
You have to say, when he's a minister, you say the Honorable Minister.
The Honorable Minister, sorry, Mr. Speaker. Mr. Speaker, I had a situation about a few weeks ago with one constituent where she came to me on a Friday afternoon and she needed some assistance, Mr. Speaker.
Yeah, member, yes. Just for guidance sake, I give you a little chance,
yes,
to
Mr.
do a little
Speaker.
prelude, but remember it's the
overdraft.
Yes.
Yes, Mr. Speaker.
So let's focus,
Yes.
Yes,
but
focus.
I'm just reading my reference, Mr. Speaker, because when the government have assisted someone that we have to say, and we have to say thank you to the government. And Mr. Speaker, I had to deal with that situation and she came to me on a Friday afternoon and my hands were tied. I came to the office of the Prime Minister the Monday. Unfortunately, he was out of state. And Mr. Speaker, I am happy to say that the staff at the Prime Minister's office, they dealt with the matter professionally and expeditiously. And I want to say a special thank you, Mr. Speaker, because there are times when we're in opposition, sometimes we tend to keep the things that the government does for us and say the bad things. But I want to just say special thank you because this individual, Mr. Speaker, she needed the help. And it happened like today for tomorrow, and she had to travel for a medical, and I want to say thank you very much to the administration. Let me be brief, Mr. Speaker, in my comment as I comment to the overdraft. Mr. Speaker, the resolution before the House today is a routine exercise. This year, the authorization is being sought for the Minister of Finance to borrow and guarantee by means of a fluctuating overdraft, a sum not exceeding in the aggregate of $108 million to meet central government's current overdraft requirements and to guarantee overdrafts to statutory bodies and public corporations for a further period of 1 year commencing July 1st, 2023, yes. Mr. Speaker, the government will borrow from the National Bank of Dominica, the Republic Bank, and any other approved financial institution. Mr. Speaker, for many years, the government was able to finance its overdraft by borrowing money, not just from the National Bank of Dominica, but also from the Royal Bank of Canada, First Caribbean Bank, and Scotia Bank. It is somewhat a poor reflection of the banking sector in Dominica today that Dominica has only one major bank, that's the NBD. Mr. Speaker, for the fiscal year 2022-2023, Parliament approved an overdraft limit of $108 million. I note with great interest a part of the resolution now before this House, which reads, and whereas these bank overdraft facilities were effectively managed and there were no breaches during this period. Mr. Speaker, it is well understood that a government needs an overdraft facility, and the opposition supports the resolution before the House today But that support, Mr. Speaker, is not unconditional. As the parliamentary opposition, what we ask is for the government to exercise prudence and stick as far as possible to the overdraft limit approved by Parliament. Mr. Speaker, an overdraft facility is there to be used in emergency situations and to cover unexpected events. Mr. Speaker, with this brief intervention, I support this resolution. Thank you.
Okay, Mr. Speaker, I stand to wrap up the debate on the overdraft facility. You will recognize that we actually increased from 5 million to 6 million. That's in terms of just beating to allow for the statutory bodies and public corporations. So that's just a little extra that we've put there. And without further ado, I think, and the leader of the opposition as well has agreed. So here's the overdraft facility, Mr. Speaker, to the House, and I really recommend, and I have no objections as well.
This concludes the debate. I will now put the question. Be it resolved that in accordance with Section 3.1 of the Loans Act, Chapter 6405 of 2017 Revised Laws of the Commonwealth of Dominica, this Honorable House authorizes the Minister for Finance to borrow and guarantee by means of fluctuating overdraft a sum not exceeding in the aggregate 108 million Eastern Caribbean dollars from A, National Bank of Dominica, B, Republic Bank, and C, any other approved financial institution to meet central government's current overdraft requirements and to guarantee overdrafts to statutory bodies and public corporation for a further period of 1 year commencing from 1st day of July 2023. Those in favor? Those against? The ayes have it. Seconded.
Labor Debo. You know, when it's good, say it's good. Well, it was a good budget. Yes. And I look forward to its implementation, Mr. Speaker. I move that the House be adjourned sine die.
Speaker.
It has been moved and seconded that the House be adjourned sine die. Those in favor? Those against? The ayes have it. House is adjourned sine die.